And the question is it true there's a period and sex position one can have with his or her partner and birth an SS child? I don't really know what this person means, but I will put the question here to you. Today we'll be talking about sickle cell anemia. And with me here is Dr. Gochinyere Jane Chilaka. Dr. Gochinyere Jane Chilaka is a consultant hematologist and a lecturer at the Nnamdi Azikiwe University Teaching Hospital, Nnewi. She is currently the head of Department of Hematology and Blood Transfusion, now to Nnewi, Anambra State.
Thank you.
Welcome, Doctor.
Thank you very much, and thank you for everybody from anybody that is listening to me now.
You're welcome. Yes, so we'll go straight to the question, Doctor. Yes, we want to know about this sickle cell anemia, and our first question today will be, what is sickle cell anemia?
Thank you very much. Sickle cell anemia, we called anemia, means there's something in the blood that is not up to the normal percentage.
Okay.
Sickle cell anemia is a branch of sickle cell disease. Sickle cell disease is when you have abnormal sickled erythrocyte. Erythrocyte means red blood cells. Okay. I'll mention however it is, and I'll also make it to be in a tone that everybody will understand it.
Yes.
So now, sickle cell disease is a genetic disease. That's an inherited disease whereby there's an abnormal sickled erythrocyte. Okay? So when they are in two, we need two phenotypic genes for us to be alive. Yeah. Okay? So if there is sickled erythrocyte, that's sickled red cell, and another abnormal red cell, which will also be another sickled erythrocyte, it means sickle cell disease. So, and from it, in that sickle cell disease, we now have sickled, that's SC, SS, S other things, SD, there's S Punjab, there's S this. All those things are sickle cell disease. Okay, from there we now bring out sickle cell anemia. Anemia is when sickle cell anemia is now the one that has S and S again. Mm-hmm. Not S and C or S and another. That's this S and S, we call it homozygous. Okay? So how do we get it? It's from our father, from our mother. A child cannot come in without getting something from here and from here. So the child will also get S from the mother, S from the father. So it means that the father has maybe AS, the mother has AS or SS for the mother to donate one S. Father to donate one S. Thank you.
Oh, thank you so much. This is very clear. Okay, and I think you've really answered my second question, which is, what is the cause?
Okay. And that's the cause. The cause is that there must be two individuals involved. Two individuals must be father and mother. And the father must, and they must have S there. It might be AS, it might be SS.
SS, yeah.
Because an SS may marry, because many of them marry and have children. So if they have SS, they must start looking for AA. They won't go and marry AS. Because they must get SS.
Exactly. Okay, thank you very much. What effect does it have in humans? What are the complications?
Okay, thank you very much. The effect it has in humans is that, one, there's a herald of symptoms. If you see someone now and you're suspecting this person has a sickle cell anemic blood, what do you see? You see that the person is retarded in growth. There's a way their face is. They call it sickle cell fascie. Sometimes they now have something called natopathy. the jaw, the teeth, the front part of the teeth will come out. The person will be closing his mouth or her mouth, and it will not be closing very well. Okay. So, and you now also see the children, you see their protruding tummies. The child that is 10 years old, you'll be telling this, the mother will tell you, this is 10 years old. He said, no, this child should be, it looks like somebody who is about 6 years old. Okay, there's retarded growth. And there are other things. Then the complications, what I said now are the things we just see. So if, they call it sickle cell features, but there are complications. Many complications are involved, starting from the CNS, that's the head, that's the brain. Okay, they are okay in the brain. Okay, they are okay. Okay, some of them are even very intelligent. Okay, but if you now come to the eye, they're always prone to retinopathy. Start having eye problem early in life. Not the normal eye problem, almost all of them for putting eyeglass. Even me, I put on eyeglass. But they have retinopathy early in life. Okay. Some of them will escape it. Then if you come to, like I've said, thought about the teeth, of course, there's plenomega. There's something called, in Igbo land, we call it omafo. You know, you start seeing the child having the spleen early in life so much that the belly will be big. Okay? There's something called hand and foot syndrome. Your hand will be very big and sometimes very painful. You know, having edematous hand and the feet. Some of them will have leg ulcers. As they are growing, they will now start having priapism. There's something called priapism whereby nobody aroused this boy, but the boy has erected penis that is very, very painful. You know, nothing caused it, no sexual arousal, but the boy will be crying in pains until some things will be done to relieve it. Many of them are having it. And after some time, it causes the person to have something called fibrosis and infertility. So, but some people also escape it. You know, some of them have children. Yeah. Yes.
Yeah. Oh, okay. Wow. Okay. How can it be managed and taken care of, doctor?
Yeah. This one are a gamut of things you must do. They usually have crises. And the crises are 4 in number. There is painful crisis, which is vaso-occlusive crisis. There are things that cause that vaso-occlusion. It's the small arteries in the blood, those things that carry blood. You know, those sickled cells, the red cells are S in shape, as if it's a sickle. You know, from these rice farmers, they know what is sickle. They use it in bringing out their rice. So now, instead of the normal oval shape of red cells, the sickled erythrocytes are S-shaped. Okay? They will be oval initially. But what will happen is that when they can't withstand stress. They can't withstand stress. So any type of small dehydration, they start becoming S. And when they want to pass through the blood vessels, they stick to the blood vessel. They cannot pass. The other one will come and stick to it. Another one will come and stick to it, forming polymerization. And that's when all of them are sticking and they're not passing through the arteries very well. What will now happen is that the person will start having pain, serious pain. And this kind of pain, sometimes it may even cause the person not to know what he's doing. That it can even cause blood supply not to reach a particular place. And whenever there's no blood supply to a particular place in your body, to start dying off. Okay, it will start having necrosis. So that's why some of them will have a vascular necrosis of the hip joints. They will not be walking well. And after some time, we'll do a hip replacement for them. Wow. It's a lot of things. Only that we just choose things that people understand. There's another crisis called hyperhemolytic crisis, whereby you will see their urine coke-colored. The way coke, the color of the coke, you will now see the child, or no, a human being, as in a young adult, having coke-colored urine. And when it starts happening, you will see the person very down, having fever. In fact, the person will start, it is a cause for hospital admission.
Wow.
So you now give some blood, intervene, and not the rest of it can kill. That's another crisis. They also have sequestration crisis. That sequestration crisis occurs only in children because they have spleen. There's big spleen. There's a lot of things that cause that. Only that time cannot permit us to start saying that. Okay. They also have the other crisis. That's the last one. That is aplastic crisis. That one, infection can cause it. Any infection, they are prone to any infection because of what the adults have. The spleen, by that time their spleen must have worked so much and reduced in size. So they are prone to that thing that would have helped us to fight against the diseases, and no more there. It is now shrunken, and by that time you are prone to malaria, you're prone to this, you're prone to that, all these infections. So aplastic crisis is somebody who is susceptible or gets an infection called parvovirus infection. So that's these 4 crises I called now. So
wow, thank you so much, Dr. Chilaka. Please, this is when you were listing all this, it was a bit scary, but can you please tell our wonderful audience how they can prevent this?
Oh, this is a very good question and a very good admonition now, because in the society we find out now that people are prone to love in Tokyo.
Exactly.
Even if you advise, we have all these advices. Okay, even the what we are having here now is a kind of telling people, creating awareness. Yes. This is what happens. This is why we should not enter into this. But you still see people entering into it with widespread eyes, open. Okay, you will see this person having loved this person, maybe from school, from the campus, they've been in love with each other, they can't live without each other. And when they find out that this person is AS and this person is AS, you come for counseling in the hospital, you come for counseling in the church.
In the church, yeah.
And, the person now says, I don't want this. Okay, some of them, they will agree. They will agree that they don't want to go ahead and marry. When they go home, 2 of them will stay together and say, let us leave these people. In fact, God can do something. There's nothing God can. There's no slogan now. There's nothing what God cannot do does not exist. Okay, that's the slogan now.
Exactly.
Okay? And when they now say this kind of thing and believe it, okay,
yes.
They now say, okay, let us start. If we get sickle cell, in fact, before we get it, we can pray and God will
pray and God
for
will
us.
just change.
Okay, if peradventure they have the first one is not sickle, they don't have sickle cell and they rejoice. Yeah. They go into second. I know but why this thing is very bad is that you won't even know until the child has gone so far.
Yes.
So you have a child, a normal child. No child is not doing anything. Nothing is happening. Very promising child. You tell yourself by the time you're finding out, the child has got set this newly that we can use some gadgets like PCR to find out around the birth time. Okay. But first 6 months of life is not easy to find out because the child is having the mother's immune system.
Okay.
So the blood of the mother is still hovering around the child in such a way that you cannot just do a genotype and you find out in this child. So that's why they don't know about it. By the time they now find out about it, they have gone far. But recently, or in the developed world, you can do some the pregnancy testing in such a way that you can test this pregnancy if there is a predisposition or if this child inside this womb is SS. It can be done. Okay. But there's an advantage, there's a disadvantage in it also. You may do that and the child will die. Okay. They will lose the baby. So now, at least I've seen somebody recently that said, can't we be doing that? So if you say, can't we be doing that, and you test this, and it's very costly, okay? I think they do one in Abuja. So when you now do that, and it is excess, you terminate the pregnancy. The child the pregnancy has reached up to the 4th month. You terminate the pregnancy. It's somehow for the woman. Whoever it is, the woman will feel it, that you have lost the baby. Okay, yes. That's one thing about that. Exactly. But if you are sure that you can carry on with that, we may even do another one and have it. It's still same thing, But some people don't mind. They just don't want to find out. But it's not problem is that the man may leave you. That's one thing about men. They may leave the woman and say, after all, I've seen this woman, let me go and get another marriage. They will now leave that woman to suffer with the children. So it's better we women should be wise.
Thank you. Okay, Doctor, we have some questions from our audience on our social media. And we got quite a number of questions. One of them is this. They said, "Dear ma, my friend who is an AS got married to her partner who is AS, and they birthed 2 kids who are not sickled. I asked them and they mentioned a test called CVS. Does it mean I can marry an AS since there is a solution?"
Okay, thank you very much. We always get these kind of questions every time. When 2 people are AS and AS, they have already married. Either they did it by omission or commission. Yes. So it might be a mistake, or that they loved each other and they wanted to face whatever consequences. Okay, there's no other test in this world that you can do that would make you know that this child is going to be AS or SS. Apart from the test I mentioned before, that you do while somebody is pregnant. You call it chorionic villus sampling. You collect from the pregnancy.
Yeah.
You take needle and put inside somebody's belly.
Wow.
And collect some
sample.
fluid. Okay? You know how it looks like. That's the only one you can do. And that time you now test it in your lab. You may test it and it will be AS or AA. But after testing it, the child inside will now die.
Oh wow!
But that you can see. What do you think? What do you feel? How do you feel? That you tested and it was okay. You started rejoicing. At least this child is not SS. Okay. But now, a man that is AS can marry AS. Yes, and they may not have SS. All these things are. Yes. There's something called Mendelian rule. It's a probability. Yeah. There's a probability that AS and AS can have all sickle cell individuals. And there's another probability that they will not have at all. Some people are like that. They won't even have at all. It is like that. So, but who knows which one? Who knows which will come? That's the only problem.
Exactly. Oh, thank you so much. We have so many questions here, but we'll just pick some because we don't have time anymore. Another question is this. If you have SS, is there a cure?
Yes, there's a cure. And that cure, most of the time, in Nigeria, we have a cure. We have stem cell transplant in Nigeria. I'm talking of Nigeria. Outside the world, yes, it has been there. But in Nigeria, there's with some sickle cell centers, or not only sickle cell centers, that bone marrow transplant centers. One is in Benin by Professor Bazwaye. That has been going on in this country for some time now. Though it is costly, but it is achievable. There's a cure whereby somebody who is SS will now be AS or AA. It is possible as long as you have the hoodie, you have the money. And you have not gone past, in Nigeria, we're doing as from 19 to, I think, 29, 30.
Okay.
So the person has not gone past maybe 40 years.
Okay. All right. Okay. Doctor, please help us with this other one. Can one outgrow SS?
Yeah, we have the myths and legends in this our environment that states that when you reach a certain age, you have outgrown sickle cell. Okay, it is not true. It is not true. Only that at a particular, if you take care of yourself, you see a hematologist. The person sees a hematologist. The person can grow old. Okay, you can't do it alone. You can't do it with any other. You meet a specialist. Either you go to a tertiary center or you meet the specialist privately. As long as you do it, you may grow old. Because by that time, what kills a sickle cell individual is all these crises I mentioned earlier.
Yeah.
All these crises, if they are reduced or to the barest minimum or it's not even there at all, how will your organs spoil? Your organs will not be damaged and the person will not die. We have people that are about 50-something, 60-something, even now in our tertiary center now that are sickle cell individuals have children and they are all living well.
Oh, beautiful, beautiful. Thank you so much for clearing it. Okay, I think let's take the last one, one more questions, because as I said, we have many. Okay, let's take this funny one. It sounds a bit funny. The question is it true there's a period and sex position one can have with his or her partner and better an SS child? I don't really know what this person means, but I will put the question here to you.
Okay. When we have already seen, maybe I am AS and I've seen my AS that I like so well, I can't even live without it. I start developing something start coming into my mind, and sometimes I start believing them. I may even start writing them, but it's not true. There's no position in sex that can make you.
So this is a big myth.
Oh yes.
Because I've never heard this too. This is the first time.
I know it's probably from people who must have been
Okay. Thank you so much, Doctor. Thank you. I think let's leave it here. And thank you for coming, and thank you for doing justice to this great topic, great subject. Thank you. So much. Oh, that's a great one. So what's your general advice to the unmarried individuals in our society?
The general advice will start from the young age. If we have children, we should do hemoglobin electrophoresis early in life. For every of our children, we should do it. That's genotype. We should do it for our children. So if you have a child that is AS, tell this child, Henry, you are AS. Ada, you are AS. So that you know that as you are AS, as you're growing up, you enter school, campus, come out, work. But as you're going ahead, if you start seeing somebody you like, you look at this person, you like this person, ask the person which genotype do you have. Okay? When you know you are AS already, and the person says AS, start looking the other way. That's the only thing.
Thank you so much, Dr. Gochinyere, for enlightening our audience on this very, very important subject. And you listening to us today, please, try and check your genotype today. Know your genotype before getting into any relationship. It will help you make a very, the best decision. Thank you so much, and please share this with your friends and loved ones. Thanks, and have a wonderful day. Bye.
Thank you.